In the labyrinth of mental health disorders, borderline personality disorder and post-traumatic stress disorder often get intertwined, creating a maze of symptoms that can be challenging to navigate. Yet despite their similarities, the paths of BPD and PTSD diverge in significant ways. Let's unravel these complexities to better understand and support those affected. Borderline personality disorder and post-traumatic stress disorder are two distinct mental health conditions that share some overlapping features, making them difficult to differentiate. BPD is characterized by intense emotional instability, turbulent relationships, and a distorted self-image. PTSD, on the other hand, arises from experiencing or witnessing a traumatic event, leading to severe anxiety, flashbacks, and avoidance behaviors. Understanding these conditions is crucial for accurate diagnosis and effective treatment. Misdiagnosis between BPD and PTSD is not uncommon due to their overlapping symptoms, such as emotional dysregulation and interpersonal difficulties. This confusion can lead to inappropriate treatments and prolonged suffering. For instance, a person with BPD might be treated solely for trauma-related symptoms, while the core issues of emotional instability remain unaddressed. Conversely, a PTSD sufferer might receive treatments targeting personality disorders, neglecting the essential trauma-focused therapies. To distinguish BPD from PTSD, it is essential to examine their core characteristics. BPD often manifests in early adulthood and is marked by emotional instability, rapid mood swings, intense emotions, and difficulty managing feelings. Interpersonal challenges, unstable relationships, fear of abandonment, and intense stormy interactions. Self-image issues, an unclear or shifting sense of self, leading to frequent changes in goals, values, and aspirations. Impulsive behaviors, risk-taking actions, self-harm, or substance abuse as coping mechanisms. PTSD, conversely, centers around the aftermath of trauma and includes re-experiencing the trauma flashbacks, nightmares, and intrusive memories of the traumatic event. Avoidance, steering clear of reminders associated with the trauma, including places, people, or activities. Basically anything that would remind them of the traumatic event. Hyperarousal, always on alert, heightened startle response, irritability, and difficulties with sleep and concentration. Negative alterations in mood and cognition. Persistent negative beliefs, distorted blame, and feelings of detachment or estrangement from others. The key moment in differentiating BPD from PTSD often lies in the individual's history and the onset of symptoms. BPD symptoms typically emerge in adolescence or early adulthood and are pervasive across various contexts. In contrast, PTSD symptoms follow a specific traumatic event and are directly linked to that experience. Moreover, while both disorders can involve emotional dysregulation, the triggers and patterns differ significantly. BPD's emotional swings are often tied to interpersonal fears and perceived rejections, whereas PTSD's emotional responses are more likely to be triggered by trauma-related cues. Understanding the distinctions between borderline personality disorder and post-traumatic stress disorder is vital for providing accurate diagnoses and tailored treatments. While both conditions share some similarities, their root causes, symptom patterns, and treatment approaches differ. Accurate identification can lead to more effective interventions, reducing the suffering of those affected by these challenging disorders. If you or someone you know is struggling with symptoms that may indicate BPD or PTSD, seek professional help. Accurate diagnosis is the first step toward effective treatment and recovery. Educate yourself about these conditions and advocate for mental health awareness to support those in need. Remember, understanding is the key to healing.